All right, so I have started this video series in which I would try to explain the concepts of movement science or biomechanics, in a very short video series, which is not very cumbersome on students, and also it gives you another explanation of these concepts, which are sometimes difficult for students to understand. Okay, the goal is to keep these videos less than 10 minutes and give you a concept that you can understand in these videos. I could have used PowerPoints, but I don't think that that's the best way to do these interactive sessions. Use the comment section as your discussion board. Put your questions there, and we'll go this old style whiteboard type of explanations here. Okay, so we're talking about movement science. So first concept that we would talk about in movement science is kinematics. In physics, kinematics is used for motion, and we are going to talk about the human motion here. When we talk about the human motion here, we basically talk about the quantity and the quality of the motion. I'll give you the example of push-ups. So, when somebody is doing push-ups, you not necessarily only want to look at how many push-ups they are doing, but also, the form of push-ups. Somebody can be doing a very poor quality push-ups, and they can do like 50 push-ups, but that doesn't mean anything, if they have not done it accurately. So you would not get the benefits of the exercise which you are performing. So that is why, quality and quantity of motion is very important. When we talk about motion, we also talk about the types of motion in human body. We have two types here. We have a translatory motion or we have a rotatory motion. Okay. So primarily, whatever gross movements that you see, in human body, that you have learned in your anatomy class, like flexion, extension, abduction, adduction, all of these motions are rotatory motions at the joint, okay, that grossly you see. That is the reason that, when we measure human motion, we measure it in degrees, okay. We don't use centimeters or meters to discuss human motions, but we use degrees to describe the amount or the range of motion, okay. So this is a rotatory motion. Whenever something is rotating, then the important thing to learn about that is that rotation has is happening in a circle, and that circle also has a fixed center of axis that you can see here. So that is the same thing that we see here in, for example, human motion. Like, for example, in this elbow joint example, you can see that we have an axis of motion, or the center of axis of rotation, sorry, not center of axis of rotation, that you can see here in the elbow joint is visible, and the motion is happening around this elbow joint. This axis, or the central axis, keeps on changing in human body. Now the question is why it keeps on changing. So you answer me this question, and I would talk about this question at the very end of this content, and we'll discuss why this center of axis keeps on changing. You can see that the center of axis is changing here on this elbow joint, but one thing is consistent, like for the most part, the center of axis, or this axis, or the central axis, would stay in the convex section of the joint. Okay, so this is the convex part of the joint, and this would always stay in this one. So that's something for you guys to think about and to understand. Okay, so talking about motion, all the motions are happening in certain planes and around certain axes. Okay, these are the three cardinal planes, okay, that all the human motions are happening in. These three cardinal planes are described based on anatomical position, which you should all know what is the anatomical position. And when we talk about these planes, we have three planes. We have a sagittal plane, we have a frontal plane, and we have a transverse plane here. The sagittal plane basically is a plane where the motions are happening in front and back. So all the front and back motions are happening in sagittal plane. You can see this green shadow here. These are all sagittal motions. So sagittal plane motions are happening in frontal plane. sorry, sagittal plane motions are happening front and back, and they're happening at the axis that is your coronal axis, or this is also called mediolateral axis. Okay, so this is also called mediolateral axis, so that's how they are happening. And then for the frontal plane motions, they are the motions that are happening on side to side. All your abduction, adduction, these motions are happening side to side. And the axis for the frontal plane is your AP axis or anteroposterior axis. This axis is also referred to as sometimes sagittal axis. Okay. Similarly, your rotational motions, like your rotation of your cervical spine, medial rotation, lateral rotation, all of these are happening at the transverse plane, and the axis for that is vertical axis. So think about that. This is the vertical axis. Any circular motion is happening around that. Okay, so think about that, like take a pen in your hand and have a key ring, and then put that key ring in the around that pen and rotate it. So you'll see that how the circular motion is happening around the vertical axis. So this is basically describes all our kinematics. Primary concepts of kinematics are planes of motion and the axis of rotation of that motion here. Okay, so now the question is why the axis of rotation or the central axis keeps on changing in the human body or the human joints. The reason for that is that, when we talk about circular motion, we are talking about a perfect circle, and that's why the axis of rotation would stay fixed. But in the human body, we don't have perfect circles. We have semicircles here. Like, you can see that this is a semicircle here. Similarly, when the human body is moving, when the human joint is moving, like the elbow joint is moving, it is also translating a little bit. So that's where comes the translatory motion. So, these translatory motions are called slides or glides. Okay, we'll talk about these in concave convex rule when we discuss that in the principles of human motion. Okay, so that translatory motion, when that's happening, that is basically your um, um, that is basically your changing your rotatory axis of rotation. This is also very important because this axis of rotation keeps on changing, and this axis of rotation can change after an injury also. Like, for example, if somebody gets an ACL injury, then they might be getting more translation in their tibia as compared to when they did not have that injury. So that more translation basically would change their rotatory axis also. Okay, so that's how the center of axis, or central axis or the axis of rotation would keep on changing. Okay, so this is the kinematics for today, and we'll go to the next lecture after that. Thank you very much, and put your comments in the comment section, and ask questions, and I'll try to respond as well.